So today I've been called to Terry. She's a 19-year-old female. She's called us because she's fallen on an uneven surface and fallen with her hand outstretched, and so she's got a sore wrist, and she's also whacked the back of her head. On the initial survey, she's alert and conscious with me now. Her airway's clear, her breathing is sufficient, it's nice and regular, and her circulation is good. She's well perfused, her colour's nice and pink. On the secondary survey, I did a quick trauma sweep and we found that the back of her head's a bit sore in her wrist, but other than that, no other significant trauma, no bleeding of significance. So Terry, did you lose consciousness at all when you fell?
Yeah, I think so.
Okay. So in regard to loss of consciousness, I'm just going to go through a couple of questions, just the A, E, I, O, U tips to rule out the cause of your unconsciousness, okay? So have you had any alcohol recently?
Not today.
No? Okay. And how about epilepsy? Does you or your family have a history of epilepsy? Okay. And then insulin, do you take any medication for diabetes?
No.
No. Okay. And then have you taken too much of some kind of medication today? Okay. Have you not taken enough of any medication today?
No.
Okay. Now, have you had some kind of trauma, do you think, that would have caused you?
Well, when I fell, I hit my head, so...
Okay. So that's the likely reason for it. Okay, we'll just go through the rest just to double check. So have you had kind of any infections lately?
No.
Okay. And you're not poisoned? Have you had anything that could make you have poisoning today? Okay. And do you or your family have a history of stroke?
No.
No. Okay. On that we can kind of eliminate everything else and rule out the fact that none of those other causes are the reason she's lost her consciousness other than trauma. She also has stated to me she's got no allergies, she has no previous medical history, she's not on any medications. And when did you last eat today, Terry?
Probably about 11 AM.
Okay, so you've had something sufficient food-wise?
Yeah.
Okay, good. And so has anything changed in your lifestyle in the last couple of weeks?
No.
No stress, no overworking?
No.
No? Okay, that's good to hear. Okay, and as we can see, your house is tidy. It's warm, there's nothing really of concern here. So what I'm going to do is I'm just going to assess your wrist first, okay? We're going to have a quick look. So if I can get you just to pull your jumper back a little bit. So what I'm looking for before I'm even touching the wrist is I'm looking for any deformities or strange angulations of the hand or the wrist. I'm looking at the colour to see that it's well perfused. We don't want to have any vascular compromise going on here. We're looking for any bruising, scarring, any swelling or redness, and I can't really see anything of that description. So next, if it's okay with you, I'm just going to have a quick feel around just to pinpoint the area of tenderness, okay?
Yeah.
And just see if I can feel anything abnormal, alright? So if you could just tell me where it hurts, and then I'm going to ask you to give me a score, okay? So we're just going to feel up the wrist here. Any pain here?
Right there.
Right here?
Yeah.
Okay. And how about inside the hand here?
No.
Nothing? And fingers are fine?
Yeah.
Okay, can you feel me pinching the end of your fingers?
Yeah.
Okay, and can you just see if you can wiggle your fingers a little bit? Okay.
That hurts.
That hurts?
Yeah.
Okay. Now, if you lift your thumb here, and we go like this, does that hurt?
My thumb doesn't hurt.
Okay. So if I put pressure here, it's called your snuff box. I'm just going to apply a little bit of pressure. Does that hurt? No. Okay. So with the fact that she can wriggle her fingers, I've pressed the snuff box and there's no tenderness here, so we can rule out the likelihood of a scaphoid fracture. She's got good vascular perfusion. She can feel me touching the end of her fingers, which is another good sign. There is tenderness around her wrist, so what would you rate that out of 10? 10 being the worst pain ever, 0 being nothing.
Probably a 6.
Probably a 6, okay. So in this situation I would be then thinking about some kind of medication and a comfortable positioning for my patient. And now I'm going to look at that wrist compared to your uninjured wrist. So if we just pull this one back, and comparing it, looking for any kind of differential here, just turn it slightly. Okay, I can't see anything abnormal or different from her uninjured hand, so I don't think there's a lot to be concerned about here other than the pain. I'm also just going to have a quick palpation of the back of your head, and you can just tell me if it's sore or not. I'm also going to be looking for redness, bruising, any kind of blood. I've already done this in the secondary survey, but we're just going to double check that it's just a bang, nothing to be concerned about. Okay, so is there pain up here?
No.
No. And how about down here?
Yeah.
There?
Yeah.
Okay. I can see just a little bump, nothing overly concerning. How about the back here at your C-spine? Can you feel any pain through here?
No.
No. Okay, so there's no abrasions, nothing popping out that I can see. I can see a little bump that's slightly red, but no bruising or scarring or any kind of fluid. So with that in mind, I'm also going to want to carry out a neurological assessment on you. It's just to go through a couple of things, just to double check that there's no neurological deficit that's happened after you've hit your head, okay? Is that alright with you? So firstly I want you to tell me, do you remember the events leading up to the fall? Do you remember what happened?
I just finished eating and then remember my foot kind of got caught going from the kitchen to the lounge.
Okay, yeah.
And then I don't remember.
So you did you experience any dizziness or a headache before the fall?
No.
No, nothing like that? Okay. And just to re-clarify, your family or yourself don't have any history of TIA or stroke or epilepsy?
No.
Okay, that's good to hear. So what we can see is that she is competent. She's having a conversation with me, which is a good start. So we're firstly going to go through a couple of quick tests and then we're going to look at your cranial nerves, okay?
Yep.
So the first one's called the Koenig sign. So what I'm going to get you to do, I know your wrist is sore, but I want you to lie flat on the ground with your legs out for me.
Yep.
Okay. Right, so what I'm going to do is I'm going to lift this leg to a 90-degree angle.
Yep.
And if there's any pain, I want you to let me know, okay? Alright. Any pain at all?
No.
No. Okay, and then I'm just going to quickly run an object along the bottom of your feet, okay? So I've just got a pen here, I'm just going to rub it along the bridges of Terry's feet. Can you feel that?
Yeah.
And can you feel this one?
Yeah.
Okay, so what we're looking for is any kind of flaring of the toes or curling forward of the back of the big toe. The Koenig sign and the Babinski sign are both used to assess neurological deficit. And with them both being negative, we can start to rule out the fact that there is no injury that has occurred, but we'll do a couple more tests. So you can sit back up now. Now have you, obviously you've tripped in the kitchen over here, so you've walked towards the kitchen.
Yeah.
You didn't feel funny when you were walking at all? No kind of issues there?
No.
Okay, that's good to hear. Right, so first of all, we're going to go through these cranial nerves. There's 12 of them. Cranial nerve 1 we don't assess in the pre-hospital field. It's to do with smell. Cranial nerve 2, I'm going to get you to do a couple of things with your fingers. So I'll get you to follow the same actions as me. It's testing visual acuity and also coordination and motor skills. So first of all, get you to stretch this arm out. I'm going to bring it towards your nose and then out towards my finger. Okay. I would get you to do the other side, but with the injured wrist, we won't be doing that. Okay, so cranial nerves 3, 4 and 5 are looking at your visual as well. So what I'm going to do is I'm going to do an eye test movement. So I'm just going to shine a light in your eyes and I want you to tell me, I just want you to look and see how that's going for you. Okay, so right, I'm just bringing this light across. Okay, and then on this side. Yep, very good. Okay, so both of the pupils are reactive to light. They're both equal as well, which is good to see. The other thing we're wanting to look at now is I'm going to do cranial nerve 5, which is assessing touch. So what I'm going to do is I'm going to place an object on your face and I want you to tell me if you can feel it, okay?
Yep.
Okay, so just close your eyes as well.
Yep. Yep. Yep.
Okay, good. So we can see that all her facial nerves are working well. There's nothing to be concerned about there. Cranial nerve 7 is to do with symmetry of the face. So when I look at Terry, there doesn't seem to be any unilateral or bilateral weakness. If you could just smile for me and just raise your eyebrows. Okay, and so all of her muscles are working in the same kind of timing. There's no kind of droopiness that I can see. She also is a young of age and her family has no previous medical history of stroke or TIAs. So we can kind of start to backtrack and rule that out as a diagnosis. So cranial nerve 8 is to do with hearing. So what I'm going to do is I'm going to whisper in one of your ears and I want you to tell me what I said and which side it was on, okay?
My left side.
Your left side, and what did I say?
I said, hi, I'm Terry.
Okay, very good. And so cranial nerves 9 and 10 is to do with your voice. sound and things like that, and so Terry doesn't sound croaky to me, she doesn't sound like she's got any dysphagia or difficulty speaking. So if I could just get you to cough for me and swallow. Okay, and so we're also checking the motor skills and the movements within the mouth and the throat, and they're all fine as well. Cranial nerve 11 is to do with shrugging of the shoulders. It's looking at accessory muscles and if there's any difficulty. So if I could just get you to move up and down, and if I place my hands here, do the same. Okay. Is there any kind of resistance, or can you feel any kind of difficulty doing that?
No.
Okay. And also when she's done that, we can see that they're moving at the same time. She's done it with quite with ease, and so I wouldn't be concerned about that either. The last cranial nerve is cranial nerve 12, and it's looking at your tongue. So if I can get you to poke your tongue out for me. Okay, and just open your mouth. Okay, and the uvula's centre, the tongue's come out centrally. There's no kind of moving to one side. She didn't have difficulty doing this. So that's good to see. So that concludes the 12 cranial nerves and the assessment that I've done. All of these assessments are looking at ruling out differential diagnoses, not only for the injuries themselves, but for the mechanisms behind the fall. I think we can come to the conclusion that something such as stroke or epilepsy or any of the AEIU tips that we've gone through are minimised, aside from the trauma, which was the bang to the head. And so I've carried out a musculoskeletal exam on the hand, the back of the head, and a neurological assessment.